All right, we've been covering a lot of mental health issues through this pandemic, which is taking a toll on so many in so many ways. Hartford HealthCare's Institute of Living is about to take part in a study looking at schizophrenia in teens and young adults. And joining us to talk about this is Dr. John Santopietro, Physician-in-Chief of Hartford HealthCare Behavioral Health Network. Doctor, welcome.
Good to be with you, Lisa.
Good to have you. So how is the Institute of Living selected to participate in this study?
Well, you know, schizophrenia, even though it affects just 1% of the population, is a really significant mental illness. And if we can catch it early, we can really make a difference. So this is a $52 million study funded by the National Institute of Health. And the Institute of Living was selected. It was an international competition and was selected among 28 other centers. And it was selected for two reasons. One is that there is a significant track record of excellence in research at the Olin Neuropsychiatric Research Center with Dr. Godfrey Perlson, and in this case, Dr. Jimmy Choi, and also excellence in clinical programming. So we have one of the, in fact, the state's only program for youth that are showing signs of schizophrenia.
All right, tell us about what the study will entail.
So if we can catch this disease early and really make an impact, that's what it's about. So it's looking at biomarkers. It's looking at things like genetics and MRIs of kids that are showing some symptoms, and also other factors like have they had a history of trauma, have they been exposed to toxins, when they were younger, and trying to figure out if we can put together an accurate list of the risk factors. Well, then we can actually look at populations and identify them and treat them early and really have an impact.
Wow. All right. What are some of the statistics when it comes to schizophrenia?
Well, as I said, about 1% of the population, which sounds on the low end, but in fact, it's a pretty significant disorder. It affects people's thoughts, and people can have delusions or hallucinations. Also, people have an altered sense of themselves, so it can really be impairing in life. And there's definitely a lot of data that show that if we can reduce the duration of untreated psychosis, so from the first time when people show symptoms to when you actually treat them, you can have a huge impact. And in youth, actually, about 3 to 7% of youth show signs that may signal that there is schizophrenia coming.
All right, what are the treatment options available for youth at the Institute of Living?
Well, the program that we'll be working with this study is called the ASAP program. So advanced programming for advanced services for adolescents with schizophrenia. But we also have two other programs, the potential program for young adults that are exhibiting thought disorders, and the schizophrenia rehab program. It's worth saying that as an organization, the Institute of Living is 200 years old and has always had a commitment to treating people with severe mental illness. And this is quite a lot of robust programming for this population. We're very, very lucky to have it.
I was just thinking the same thing, Doctor, that how lucky are we to have such great mental health care right here in Connecticut. Dr. Santopietro, thank you so much for joining us, and keep us posted on the study. Thank you.